Hi, Grant Garcia from Seattle, Washington. Today we're going to do a case presentation. This is a multidirectional stabilization using all knotless fixation. So this patient's 22-year-old female, over 100 subluxations, continued hyperlaxity, continued pain instability, and failure of physical therapy for over 2 years. The examination here was range of motion was normal, rotator cuff intact and neurovascularly intact, positive sulcus sign, and 2+ anterior and 2+ posterior load and shift. So the MRI findings demonstrated a large labral tear with capsular redundancy and a normal cuff and normal cartilage. So my surgical reasoning for this patient was inability to return to sports, continued pain and instability, and 3 directions of instability, also known as multidirectional instability. So the data here is Garcia et al., AJSM, 49 shoulders, over 5-year follow-up. These were all MDI patients. They had a minimum of 3 anchors anterior and 3 anchors posterior. And you can see the results, 88% survivorship at 5 years, 82% at 8 years. This is excellent for this patient population. What's important here is the operative plan. So lateral positioning, I do a unique setup here with the Tremano and the lateral jack. I like this for ease of setup, but I also like it for, especially with more difficult standard labral repairs, it's hard to get access, and I have excellent access with this, so it saves me time in the operating room. 3 portals are used here. So I have an anterior 8.25, I have a posterior Gemini cannula, as well as an anterior superior viewing portal. All of my anchors are going to be 1.8 knotless FiberTaks. I'll use between 6 or 7, and I'll do a pinch and roll technique here for the MDI patients. This is different from my standard labral repairs. So here we're going to start our posterior plication. Again, I always start posteriorly. You can see we just have the Gemini in the back. There's no accessory portal needed for this type of situation. We're going to place the FiberTak low down. And again, it's important here after you fire it to load it to make sure that it's intact. We're going to use a rotation lasso here, and this is the pinch and roll technique. So we maximize capsule, maximize surface area, so then we compress it down and it will heal back down. And after we pass this, you'll see there's a coating on it. That allows it to not get tangled or damaged. And then you can easily just pass it through, and you don't have to pull it all the way out the shoulder. And here we've already completed our pass. You can see how quick that is. And then we're going to lock down the knotless FiberTak. And then we're going to repeat this 3 times. So you see our 3rd anchor going in, and this completes our posterior plication. Now we're going to work anteriorly. So again, no accessory portal needed for these. So rotation lasso, pinch and roll, really tightening up that inferior glenohumeral ligament. You can see here that we have an excellent pass. Again, very quick. And we're going to repeat this 3 more times. And now you can see we're going to cut each one individually after final tensioning, and we're shifting even further that capsule. And now you see we completed this entire repair. Finally, we're going to do our posterior capsular closure. So we're going to use a suture tape. We use the rotation lasso for the first pass. And then the second pass, we're going to grab it with the bird beak. And then we'll tie this outside the shoulder to complete our capsular closure and prevent recurrence. So the postoperative rehab on these patients, we have a gunslinger at 15 degrees for 6 weeks. And then we have passive motion starting at week 4, active motion starting at week 6, and return to sport is 6 to 7 months. Final comments, rotation lasso for me, game changer. Faster passing, you can use it bidirectionally, which is excellent. Anchor-based plication is more robust for MDI patients, and I will use this even without labral tears in these patients. Finally, knotless FiberTak is a workhorse for me in all labral repairs, but especially in these more complex repairs. It's got low footprint, you don't need accessory portals, no knot stacks, and you can retension. Thank you.